For the next artery we are looking at, we will look at what is known as the superficial circumflex iliac artery. Okay, so well, this one is deep circumflex iliac artery. The superficial is still the same, just that this one will be more up. You understand? Superficial circumflex artery, that will be up. The deep one will be underneath. You understand? So let's look at this artery and make progress. Okay, so for this artery, we say that it's the smallest cutaneous branch of the femoral artery. We see that this main thing is a femoral artery, and of course the superficial circumflex iliac artery is actually a branch of it. You know, so that it runs laterally towards the anterior superior iliac spine, and it supplies the skin and fascia of the inguinal region and the lateral abdominal wall. So what's the origin? Arises from the femoral artery, just distal to the superficial epigastric artery. Okay, so size is considered the smallest branch of what? Femoral artery. So how about the course? It emerges near the saphenous opening. It pierces the fascial lata. It runs laterally and parallel to the inguinal ligament towards the what? Anterior superior iliac spine. Okay, so it travels in the subcutaneous tissue over the lateral pelvic wall. It's going away, so it's going laterally. So branches, no major branches, you know, but tiny branches are spread into the skin, superficial fascia, lymph nodes, you know. So it will connect with arteries like the deep circumflex iliac artery, the superior gluteal artery. Okay, then let's move the lateral circumflex femoral artery, and it supply the skin, the subcutaneous tissues, you know, the superficial inguinal lymph nodes. So clinical relevance is actually important in surgeries that is done around, you know. Okay, for reconstructive, you can actually pick it up and put it elsewhere. You understand? Variations, you know, how it is actually is different in different individuals. Palpation and access, I can use this for palpating and actually identifying structures. Okay.